and it is my honor to welcome you to our webinar this afternoon, where we will dive into understanding our latest Central Ohio Child Care Provider Survey Report, The Tipping Point. I will be serving as your MC today, along with my colleague, Marketing and Communications Manager, Christiana Szilard. Today, you'll be hearing from Action for Children CEO, Dr. Eric Karolak, Action for Children Step Up to Quality Program Manager, Brittany Jackson, and Mary Beth Salamone Testa with MBST Solutions. As the local child care resource and referral agency for Central Ohio, Action for Children is committed to assuring quality early learning experiences for all children. For over 50 years, our services have focused on transforming the lives of children in SDA 9 by supporting the everyday heroes who most influence our children's early growth. Those, of course, are caregivers, educators, parents, and guardians. On September 11th, 2023, our online survey was distributed to 1,239 licensed providers in Central Ohio counties, which include Delaware, Fairfield, Franklin, Licking, Madison, Pickaway, and Union counties. A total of 419 responses were collected. Making up those responses were 266 child care centers and 153 child care homes. Our results are statistically significant with 95% confidence with a margin of error of 5%. The qualitative data was gathered through open-ended responses and focus groups with survey respondents to understand the real-world perspective of the findings. Now, a few housekeeping notes before we get started. All attendees are muted and have cameras off. If you would like to submit a question, please use the Q&A button located at the bottom of your screen at any time during the program. Christiana will be monitoring the Q&A, and we will get to as many questions as we can during the Q&A portion of our program. Pre-submitted questions will be answered first, and some pre-submitted questions have been worked into our presentation. If we are not able to get to your question during the program, don't worry, we will send a list of those questions and answers along with the recording of the webinar to all of you by the end of the week. All right, so let's get to it. It is my pleasure to hand it over to our Action for Children CEO, Dr. Eric Karolak.
Thanks, Natalie, and thank you all for joining us for this session. I want to give a special shout out to our report authors, Mary Beth Salamone Testa and Samantha Marshall. You'll be hearing from Mary Beth in a moment. And to our data analyst, Ryu Tan, who's not able to join us today, and Christiana Szilard, as you already heard from Natalie. Ryu and Christiana served up this data in a way that's easy to consume and hopefully to act on. AFC began this series in 2020 at the start of the pandemic to answer questions about what was happening in childcare. And after now 8 iterations, and I believe the 4th report, we've created a curated data set with statistically reliable results at high confidence, thanks to our strong relationships in the community. And it's been used to help direct the public dollars beginning in 2020 with the CARES Act funding that was available then on through the American Rescue Plan Act, whose funding flow has now come to an end. This resource is available to all advocates, public officials, business leaders to inform decision-making, and we have some serious decisions to make. Though a year has passed since the last time we issued a report, and 2 years since the last time Congress acted, appropriating money for childcare in the American Rescue Plan Act, we still are in need of asking leaders to invest in families and in the early childhood workforce, and to invest in both of them at the same time. Childcare is still a crisis for families, for the childcare workforce, and for our economy. Childcare is too often a brake on family sustainability, on business growth, even child development, when it should always be a catalyst. Look, you want to hear from the survey report, so I'm going to turn this over to one of the report authors, Mary Beth Salamone Testa, who's principal at MBST Solutions. Mary Beth, take it away.
Thank you, Eric. And thank you everyone for being here today. My name is Mary Beth, and I'm a consultant. I'm an advocate, and I get to be a part of this field working at the federal level and in a variety of states, helping to connect policy choices and real life. And the biggest and best part of that work is the listening to the early childhood workforce in family childcare and in centers, and helping others to take the time to do that listening too. So it is in that spirit that I thank you for coming today. Thank you to the Action for Children team for the deep work you did together to get this survey done again. And thank you for including us to help people understand the findings and to engage in the recommendations. I want to give just one more shout out to Samantha Marshall, who is here with us today. Thank you for the great work that you did in your writing and your analysis. I could not have done this without you either. Thank you. So let's talk. The role of Congress in childcare is huge, but members of Congress have delayed decision-making on childcare some more again. This delay includes those investments needed annually in the childcare law that we have, and also in this crucial investment boost that is needed. Congress has extended funding for federal programs through the early part of next year. The US Senate and House are right now debating what they call the top line number. That's the whole of what they're going to make available for things that are funded through the annual appropriations process. The House and Senate are still not together on a deal, and the House is pushing for cuts, including to childcare and to early learning programs. And none of this particular debate and delay are going to be about those big, good ideas, those important reforms that are going to make sure that all of childcare actually works really well for the early childhood workforce and for families. Meanwhile, the childcare crisis is very real nationwide, and we can't get tired of talking about this and using the data, the national data and state and local data like this in Central Ohio, and the stories to get done what needs to be done. Many leaders are trying and doing good. Maybe they're doing it a piece at a time, but this piecemeal approach does not take the place of the whole and comprehensive picture that we need. There's a role for Congress and for state and local government, and there's a role for philanthropy and area employers right away. I cannot emphasize enough the value of and the learning that comes when we listen to the early childhood workforce. In Central Ohio, they're sharing that their biggest concerns are about having enough to eat. They're worried about being evicted from their homes. They're worried about the families. They know what they see and they know what they need. Again, thanks for coming today to listen to them through the findings of this survey. More than 80 people registered for this webinar, and you're here as part of your role in government or part of your role as researchers and advocates here in Ohio and at the national level. And we even have friends here from Maryland and Indiana and California, and many of Central Ohio's early childhood educators have made the time to be here today too. So thank you all. Natalie, next slide, please. So here's what the 2023 data tells us overall. For those of you who are deep in this space, this will unfortunately not surprise you. It should worry every one of us. Caregivers cannot afford to enter or stay in the field. We have enrollment challenges. If Central Ohio childcare programs were able to operate at their full licensed capacity, an estimated 9,925 more children could be enrolled. For the second consecutive year, more than half of Central Ohio providers have raised their tuition fees, and another 2/3 are planning further increases in the next 6 months. We're going to talk about the reasons today. Meanwhile, more than half of providers report that their monthly revenue does not cover expenses, and the stabilization grants worked and more is needed. Next slide, please. So let's do some of that listening to providers by way of the survey findings. Next slide, please, Natalie. The Administration for Children and Families at the U.S. Department of Health and Human Services reported on the Centers and Family Child Care programs in Ohio and everywhere that received stabilization grants. Those grants to centers in Ohio amounted to, on average, over $180,000. And for family child care programs in Ohio, it was on average more than $33,000. They use these dollars to take care of some pretty basic human needs: wages, rent or mortgage, utilities, and supplies. These grants made it so that providers reported a less likelihood to close in a short period of time because they knew the money was there to cover their expenses. They were confident. But even though they were less likely to report closing in the coming months, only 8% of Central Ohio providers reported that they were not going to be affected by the end of these grants. In other words, 92% of Central Ohio childcare providers will be impacted by the end of the stabilization grants. They're confident they'll be open and confident they will be struggling. Next slide, please. We have ongoing, so the stabilization grants are ended. The end of that timeline has been reached from federal instructions. It's in the hands of state leaders now, but we have ongoing the federal child care law sending child care development fund dollars to states. States have a lot of choices to make, like which childcare programs get to participate, how much is paid, which families qualify. People in the state of Ohio count on this funding, and we're watching and waiting for Congress to do what? To do cuts, to do investments, to invest big or not enough, or to do nothing at all, or to keep extending their work timeline. For now, we have ongoing the Child Care and Development Fund dollars in Ohio, and Ohio calls this publicly funded child care. This assistance can be a lifeline, this huge difference between childcare access and a day, a week, a job, a family falling apart. For childcare providers, every incoming dollar counts and gets used. And in our report on page 7, there's a little bit about how that works, where it comes in from and what it goes out to. We're thinking about those who have raised tuition, more than half of Central Ohio providers, and their reasons for having to do so. And they're stuck, right? Because they can't price out their parents or they'll lose them, but also there are staff to pay and bills to pay. And now think about those who are in Ohio's publicly funded childcare subsidy, and those with high numbers of subsidy. 38% of Central Ohio providers have all of their enrolled families coming in by way of publicly funded childcare. We looked across the data and saw that the more a program enrolled publicly funded childcare paying families, the less likely they were to raise tuition. The policy constraints about rate setting mean they can't raise tuition. They're stuck in this amount for an operating budget, and it simply and dramatically doesn't work. But still, we're left to stand here and watch. Half of Central Ohio providers shared with us that parents don't enroll in their program because of the price. Too few have the support of publicly funded childcare, and that's part of the problem. 40% of providers, both family childcare homes and centers, report their largest challenge was not enough enrollment. 1 in 3 centers indicated not having enough staff coverage. An estimated 1,626 early childhood educators are needed, and that's for childcare centers alone. If Central Ohio childcare programs were able to operate again at their full licensed capacity, we're talking about an estimated more than 9,000 more children that could be supported. And so this is the cycle, right? There needs to be staff But low wages lead to a staff shortage. If there's not staff, we can't enroll children. If we can't help families afford it, they can't enroll either. If families don't enroll, we don't have revenue. If we don't have revenue, we can't pay our staff. If we don't have our staff, we can't get to enrollment, and it's broken. The stabilization grants were a crucial intervention into this ridiculous cycle. It made good things possible. And now we're back to the delicate balancing act. Let's talk about wages for early childhood educators in Central Ohio centers and family child care. Next slide, please. In a center in Central Ohio, the median highest hourly wage is currently $17 an hour for a lead teacher and $14.25 for an assistant teacher. In family child care, we learned that 48% of Central Ohio family child care providers don't pay themselves. And those that do find that the monthly wage is only an average of $1,454 for the whole month to take care of themselves and their family. I noted earlier that more than half of Central Ohio child care programs don't have enough monthly revenue to meet their expenses. And that monthly revenue is where the wages come from. So it doesn't work. Center leaders and family child care leaders are deeply concerned about this. They know there's so many other jobs that pay more. They're sacrificing their own wellness, their own financial obligations, and their own needs. We asked family child care providers who don't pay themselves why. Because they're paying their bills first, because they're accepting whatever is left after bills are paid, after operating costs and supplies for a good experience for children are taken care of. Over and over, they said, I can't afford to pay myself. Center leaders told us about the cycle over and over. We can't pay well enough, so we don't have teachers, so we can't enroll families, so we don't have revenue, so we can't pay. Next slide, please. This year's survey asked for the first time about access to health insurance. 2/3 of child care centers in Central Ohio do not offer health or dental or vision insurance to their staff. Only 1 in 4 family child care providers has health insurance for herself, and even more are lacking dental and vision insurance. As we think about the wages that are possible without an investment outside of parent fees and Ohio's publicly funded child care payments, and we think about the more than half that don't have enough revenue for their monthly expenses as it is, this finding is not surprising, but it's really troubling, and it can be fixed. We took a quick look at the work of the National Kaiser Family Foundation. We found that 1/3 of childcare centers offer health insurance. Kaiser folks found that half of all businesses and 3/4 of firms that have 25 to 49 employees offer health insurance. While only 1 in 4 family child care workers has health insurance for themselves, 90% of all workers do. So in childcare work, how are they getting to medical care? How are they taking care of their basic health or serious health concerns or prevention? Well, some might not need their center employer to offer it. They might participate in employer-sponsored health care through a spouse. This is certainly possible for family child care as well. Some child care workers are eligible for Medicaid because of their low income. But the number one reason center leaders don't offer it and family child care leaders don't have it, they can't afford it. There's a lot more we ought to dig into about this in Ohio and beyond. I'm happy to hand things over now to Brittany Jackson. Brittany?
Thank you, Mary Beth. My name is Brittany Jackson, and I've been on the Action for Children team since 2014. I am the Step Up to Quality coordinator, and every single day I am in touch with early childhood workforce in centers and in family childcare around Central Ohio. Every day I see and hear and feel the data that Mary Beth just shared. We have to fix this. Natalie, next slide, please. So, next slide, please. Oh, no, I'm sorry. I'm sorry. Go back. One thing I always hear is staff. We need more staff. Hiring bonuses are one piece of the solution. And it's important to understand that this is just one connected piece, but it can't be the only piece. Another thing I hear is being able to afford rent. And this is so troubling. I often hear from childcare owners how they don't know that they're going to make their rent and that they're going to close their business because they cannot afford to stay in their space. Overall, here's what we're talking about. To create the much needed comprehensive approach, leaders should support a mix of settings for childcare. Leaders should ask questions, assess the need, and understand parent demand and preference. Leaders must use data to set investment levels and opportunities and invest in operating costs in addition to offsetting parent fees for childcare. It is complicated, and there is not just one thing or just one way. Leaders must remember the variety of hours each day and days of each week of workers in various jobs. Next slide. Sorry, everyone on this webinar today can leverage the power of partnerships by engaging with childcare providers, local government, nonprofit, and Action for Children. Thanks to the expertise of the Central Ohio Family Childcare and Childcare Center leaders, we have some specific ideas. Mary Beth, would you please share?
Thank you, Brittany. Childcare program leaders in Central Ohio are keenly aware of their families' affordability challenges. This work is truly very personal. Significant, sustained investment is needed so that timely, sufficient financial support is available to families, including things like Ohio leaders expanding family eligibility in publicly funded childcare. Federal leaders can invest so that all eligible families are served. Employers in Central Ohio can bolster families' abilities to be at work by offsetting families' childcare expenses. They could also contract or sponsor with an area childcare provider or probably multiple childcare providers to ensure that space is available. Quick detail note about that. It's important that that contract or sponsorship ensures that the caregiver is compensated at a competitive rate with health benefits. We can choose that. And city and county leaders across Central Ohio can invest in innovations. For example, Franklin County leaders standing up Franklin County Rise. Ohio just this year increased the income eligibility threshold for publicly funded childcare from 142% of the federal poverty level to 145% of the federal poverty level. It's a small increase, but an important step in the right direction for Ohio. Nationally, we also know that only 1 in 6 eligible families is served. We've been saying that for far too long. But we can't only do the work of offsetting childcare costs for families. It's an important part, but alone it's not enough. We also must invest in the child care program operating costs, including compensation that is the basis of quality and reliability that families and our whole community are relying on. Brittany, would you please share?
The stabilization grants funded by Congress worked. This was an effective intervention, but federal funding stopped coming. There is urgent need for a sustained, flexible investment to be used in centers and in family childcare programs. It is everything, all the things, as you can see here. This isn't a menu for choosing. This is about all of it. A family childcare provider in Central Ohio shared, stabilization grants gave us a chance to do things we wouldn't have been able to do. Nice things for children, being able to serve our families better. A lot of people were out of work during the pandemic. We helped our parents out too. No one had to bring diapers and wipes. I supplied them because I was given this money and I used it for rent too, but I used it to help families who were struggling. I invested in them, and in return, they do everything they can now that they're back to pay on time. They needed the help. This year's report has a spotlight on provider wellness, or really our concerns about that. A spotlight on stabilization grants, and another about families at work. I encourage you to check those out. We cannot emphasize enough when we talk about the early childhood workforce that this is about people who have basic needs and families to support. When we talk about families, this is about the whole of their success. That goes beyond securing a childcare slot. Families are choosing which bills to prioritize, and childcare bills are only one of their obligations. People need healthcare, housing, enough to eat, and job quality along with wages and benefits to afford basic needs. Stabilization grants and other federal policy interventions made a lot of things possible, and now we return to the fragile balancing act. Eric, over to you.
Thank you, Brittany, and thank you, Mary Beth. Childcare can sometimes be a very heavy burden, but like the moms, the families, the staff, others who bear that burden every day, as advocates and as community members, we cannot let it weigh us down. One provider told us that she was at a tipping point, hence the title of our report. It's an apt metaphor. The question for us is, do we lean in and build on and do more, picking up those things that have worked well, that have been running us in the right direction, expanding access, improving rates for providers, improving the system of care? Or do we step back and throw up our hands and say, we can't do further? I think you know the right answer here. It's dependent. It's not just the right answer for a particular family or program. It's for our community, because childcare is essential for all of our community. We've already talked a little bit about some things that can be done. The good news is that together we can accomplish more. There are steps that can be taken, small to large. You don't have to worry about finding the right answer. The important thing is to do something and to recognize that investment is needed so we can do more together. Childcare is a part of the economy that has failed, has not worked the way it should for families, providers, communities, and others. And we're ready to work with federal, state, and local government, as well as corporate and philanthropic leaders, to take a comprehensive approach to solving the childcare crisis, rooted in the needs of the childcare professionals and the families closest to the challenge that this report highlights. Now is the time that we all do more, to use our influence, to use this data, to listen to our employees, invest in them and the childcare providers that they rely on. No one is off the hook. The one thing we cannot do is look away. So please turn to the Tipping Point report yet today while the link is in the chat. I'm going to turn this back to Natalie and thank everyone for joining us. Natalie, over to you.
All right. Thank you so much, Eric. And thank you so much to all of our wonderful panelists. Well, we have some questions that we need to answer. And I am going to throw it over to Christiana. I know we had a few pre-submitted questions that we're going to answer first. And I'll toss it over to you, Christiana.
Great. Wonderful, and thank you so much. So we have our first pre-submitted question, and that question is, what are families doing if they aren't enrolled in Central Ohio child care programs? Brittany, would you like to answer that?
Yes, families who are not enrolled in these programs are either leaving the workforce or not going back to work. And this, of course, negatively impacts the economic growth of Central Ohio region. If parents are going to work and the children are not enrolled in these programs, they are relying on their family, the grandparents, sisters, cousins, or neighbors to care for their children. In many situations, these individuals are not being paid for their time or care.
Great. Thank you for answering that question, Brittany. Our next pre-submitted question is with Intel expanding operations in Central Ohio and needing a large number of workers, what should we be thinking about and doing? And Eric, I'm going to ask you to answer that one.
I get all the Intel questions. Thanks. Intel's on everyone's mind, but that question's not really about Intel. Intel has no special, unique responsibility, no greater responsibility to solve childcare than any other employer or any other organization in our community. Now, it does have more resources, and that's thanks to the CHIPS Incentive Act that Congress passed, and that includes a requirement that semiconductor manufacturers create childcare plans to accomplish, to address the needs of their workforce and their construction workforce in finding childcare. One of the resources that Intel and other semiconductor plants have, manufacturers have, is a report created by Action for Children earlier this year, CHIPS and Childcare in America's Silicon Heartland. And I think Christiana can put a link in our chat to that report. And it describes some really, smart solutions, things to think about as Intel or any business might confront this issue. Leveraging the existing childcare infrastructure. Remember all of that unused, not fully maximized enrollment capacity that's out there. The existing infrastructure, and that includes not only childcare centers, but also home-based family childcare programs. In the report, we identify what existed at the earlier point in this year. There's not much in that area for Intel. And so some of this solution has to also be thinking about how to partner with public entities and a public-private venture to expand the options available. And there are some really important principles when thinking about how to develop a child care plan that they should be thinking of. We went over those in some detail, so I won't belabor this, or just refer you to the report. But it's really important that you think about what the needs of your workers are. And Intel's workers in the fabs, plural, once they're built, will probably have some different needs than the construction workers, the thousands of construction workers who today are looking for childcare to be able to assure that they can be at work on time and fully focused as they need to be as parents. We also know that they should be thinking a bit about where that childcare is located. And for an enterprise like Intel, especially in this construction phase, that's probably not certainly not all in Franklin County or even in our Central Ohio region. It may be a bit far afield. And so working with other organizations, child care resource and referral organizations are your first go-to for this. And we've talked to folks in New York who are working with Micron, and in Missouri and Texas. There are other resources to help an organization like Intel spread across a large geography with developing its child care plans. But really, Intel has no greater responsibility than any other employer to be thinking about the child care needs of its workforce. And it's not just, do we have the workers? It's also which workers and who has access to the benefits that those jobs command. Childcare is an equity issue as much as it's an economic or educational issue.
Eric, thank you for answering that question. We have a couple more questions. And one of these, we actually have a guest from California who submitted a question. They would like to know how we can be more involved as childcare professionals to advocate for ourselves. Eric, would you like to take that question?
I can, but I'm feeling like we have a native Californian who might do this even better. Well, the first thing is to be involved, whether that's with your local informal family home-based childcare council or organization. We have a a very active listserv and an organized group here in Central Ohio, or maybe it's through the National Association of Family Child Care or the National Association for the Education of Young Children, our professional associations in the space, or with a state or regional early childhood advocacy organization. In Ohio, Groundwork would be your statewide organization, Ohio AEYC. In California, there's California AEYC, and other organizations. So being involved, connected is really important, because alone your voice speaks for a half dozen, perhaps 24 children that you are working with, supporting them and their families right now. But together, united together, you represent a voice that assures the safe care and the informed, structured development of a young child for a working parent, and that's for thousands of working parents, and that's extraordinarily valuable to the community. The other thing you can do is be responsive when folks reach out, not only to surveys like this one, but to national surveys that often are trying to level set across the nation. So being able to provide your input in that fashion, just like Central Ohio Child Care providers have done with this survey, is extremely valuable. And then being ready to pick up the phone, to send an email, to text nowadays as well, is extraordinarily valuable. When asked, answer the call. No one sends out an advocacy message lightly. Mary Beth, you're the native Californian here, if I remember correctly, and you work with a lot of home-based programs across the country. What would you add?
Thanks, Eric, and Benny, thanks for the question. I guess I wanted to add to what Eric said. You had terrific examples for the provider side. For those of us who are not providers, we have a responsibility, right, to authentically welcome the involvement of childcare, the early childhood workforce as advocates, whether they work in centers, whether they work in Head Start, whether they work in family child care, whether they're in a faith-based program or they are relative caregivers. We have a responsibility to authentically bring them in to our spheres of influence and to use that influence together. So wanted to just welcome everybody on the call who's not an early childhood educator, to take yourself up on that too.
All right, Mary Beth, while you're actually still on the horn, we have another question about the findings about the lack of health insurance. We're finding these a little bit concerning, and what can we do about that?
Thanks. So childcare providers need to make wages in which they can afford health insurance. We can create policies and systems in which childcare providers can afford to either provide health insurance to their employees or get it for themselves. And that's both about childcare policy systems and about healthcare policy systems in this country. A public-private partnership could bridge us toward that long-term work for policy change. Again, a role for everybody, so let's find ours. Importantly, we need to understand what this workforce has, wants, and needs, and then address it together. A lot more data is needed here, and we'd love to connect about that.
Right. Thank you for answering that, Mary Beth. Right. At this time, I think we have answered all the questions that have been submitted. At any time, you can also email Action for Children just to info@actionforchildren.org as well.
All right, thank you so much, Christiana. Well, thank you to all of you for joining us today. And again, a special thank you to our esteemed panelists for your insight and your expertise. We will be compiling all of these questions. And again, if you weren't able to submit a question, but you still want to ask your question, please be sure to email us at that info@actionforchildren.org, and we will add that to the list and we will send that out with the recording to all of you later this week. Again, Thank you very much for joining us. Have a wonderful rest of your day, everyone, and continue to do good work. Take care.